I'm with Dr. Victor Dzau, President and CEO of the Duke University Health System. Hello.
Hi.
Dr. Dzau, what are you addressing this year at the World Healthcare Congress Middle East?
I have two topics. One is on innovation and what it means to healthcare. The second one is on the issues of healthcare delivery models globally, particularly in US.
And what are some of the challenges your organization is facing in the healthcare industry?
Well, we are in the United States, as you know, undergoing significant changes related to healthcare reform or the passage of the Affordable Care Act. And so much of our effort is looking at how to move from today's environment of fee-for-service volume to a value-based system in which outcomes is going to be greatly rewarded.
And what are some of the innovations your organization brings to healthcare?
Well, we do many things. We are an academic health sciences system, and so we have started with discovery science to translation to looking at outcomes, community health, population, and global health. We do all of the above. So in that context, our innovation is throughout the entire organization. There's not one single point. It's at every step, at every level organization. For example, we're the institution that discovered and invented Myozyme, which is a treatment for a genetic fatal disease called Pompe disease. We also, organization, our scientists first invented the idea of thymus transplant for a condition called DiGeorge.
Yes.
We're also a place where we do vaccine for brain tumor. But we also look at delivery, looking at how do we improve the care of our patients and delivery to the community. So among the things we do, in fact, is patient-centered medical homes, looking at new ways of delivering of care around the patient and team-based approach. So the innovation for our organization is central to our organization. We do it at every single level, from research to patient care.
Why is an event like this so important?
Well, I think it brings together the critical players and stakeholders in healthcare and to exchange ideas, to learn from each other, and importantly, drive each other, in terms of towards innovation and towards what's best for our patients.
Continued innovation is vital in healthcare and healthcare delivery. What are the main obstacles to innovations in the developed world and the developing world?
Okay, yeah. So in developed world, I think the obstacles in any place to innovation is the inability of people to think out of the box because they're so conventional. They're surrounded by a very traditional environment. And so they're afraid to think about things which are outside their comfort zone, right? So that's number one. There's a lot of things that can inhibit innovation in the developed country, such as a way of using technology. Physicians and people don't want to use new technology because they're comfortable doing what they've been doing, right?
In the developed world.
In the developed world, yes. Or for that matter, professional barriers, right? Because this is always what doctors do, what nurses do, and the inability to say, let's just think about beyond those barriers to see what the right skill set is. Regulatory problems in developed countries. As you know, FDA, many others, sometimes create so much regulation that inhibits innovation. Intellectual property, who possesses what? So there are many issues in developed world. You don't see that in developing countries. In developing countries, the innovation is usually trying to solve a problem, right? What I call necessity is the mother of invention. People are very creative in solving problems, but they have a lot of challenges too. We have an organization called the International Partnership for Innovative Care Delivery.
Yeah. Can you please tell us more about that?
And so this is founded by Duke with the World Economic Forum and McKinsey. And we have a large number of supporters from both the nonprofit as well as from the profit organization. And our role is to study what are the innovative health delivery systems across the globe. People who are able to find faster, cheaper way of doing things with equally good outcome.
Good quality.
Yeah, good quality, exactly. So, for example, people talk about in India, there's a eye care called a ribbon eye that can do, you know, 250,000 cataract surgeries a year at a cost is about 100 to 1,000 of what we cost, right?
Yes.
With good outcome. So, but when we talk to these innovative entrepreneurs, what are the barriers? We studied very closely what are the success factors and what are the barriers. We found